And in health news this morning, we're taking a look at one of the most common neurobehavioral conditions in kids and adults. More people are taking ADHD medication, which is actually leading to a shortage of the drug Adderall.
Daybreak's Lauren Hall joins us live this morning with important information you need to know from a local doctor. Good morning, Lauren.
Good morning, Melissa. Good morning, Pete. Adderall usage shot up 10% from 2020 to 2021, and the FDA declared an official shortage last month with no real end in sight. Some experts say this could be linked to the rise in telehealth services during the pandemic, allowing providers to prescribe the drug to patients out of state for the first time. Another theory is that some people's symptoms became more prevalent while working and learning remotely. Even the high amount of ADHD content and creators on TikTok have made it easier to access information about it from home. So if you're wondering, here are some of the most common symptoms. If you make careless mistakes, if you don't seem to listen when spoken to directly, if you're easily distracted, forgetful in daily activities, or if you're fidgeting, tapping your hands, squirming in your seat, talking excessively, or have trouble waiting your turn. Dr. Michelle Hartley-McAndrew of the Department of Developmental Pediatrics at Oshai Children's Hospital says, though, even if some of these symptoms sound familiar to you, it's not necessarily an indicator that you have ADHD or need medication.
So this is something I tell to my parents and, of patients that come into clinic. We're all a little ADHD, we're all a little, depressed, we're anxious. Just how much is it getting in the way of our daily function? If you're starting to feel that you're not able to function at work or in relationships or that kind of thing, then certainly, get evaluated.
Now, to get diagnosed with ADHD, here's how it works. You have to meet either 6 or 7 criteria of hyperactivity, impulsivity, and inattention, some of which we just went over a few moments ago. And if you're going to get screened, Dr. Hartley-McAndrew urges patients to see their local primary care doctor or a specialist to manage their symptoms and medication. And that's because with this drug shortage, some patients may need to change their treatments based on availability because, Pete and Melissa, as we mentioned, really no end in sight to this Adderall shortage right now.
Oh, interesting stuff. All right. Thank you very much for the update, Lauren.